loss drugs like Ozempic, Wegovy, Mounjaro are popular, but they can cause health concerns, especially for people 65 and older. Dr. Jodie Pepin is the Pharmacy Program Director with Harbor Health, and she joins us now to talk more about this. Dr. Pepin, thank you so much for joining us and for your time. So why are these weight loss drugs especially harmful for the 65 and older crowd?
Well, it's not that they're like especially harmful. I mean, any drugs when you're 65 and older. I mean, 65 is not really old anymore, right?
No.
But there are people who are 65 that are more like in their 80s, and then some 80-year-olds that are more like in their 60s.
Absolutely.
And so it's very individual based on your body and your comorbidities, whether health concerns, other medications you take. And then the older we get, the more likely those things are to happen. So that's why there's more of a concern. And as we get older, like our organs, our blood flow to our organs slows down, so we don't metabolize drugs the same, we don't excrete drugs the same. And so it's just a very cautionary warning to people that these aren't like for everyone. And
right, and as we get older, we lose muscle mass, so if you lose weight too quickly, what happens there?
That's a big problem because I think between the ages of 60 and 70, it's been reported that we lose about 10% of our muscle mass. And so when you take these drugs, whether they're for diabetes or weight loss, because they're the same drugs, then you tend to lose weight, and it's not necessarily fat that you lose. You lose lean muscle mass, and so this puts older adults at risk of falls, bone fractures from hip fractures, and head injuries and all kinds of things. Depending on other medications that they're on, that can contribute to the fact that their muscles aren't as strong and they don't support them as well.
What about kidney and liver functions?
Kidney and liver functions decline naturally as we're older. Just because of blood flow slows down, we have more things in our arteries that probably shouldn't be there that slow down our blood flow. And so we don't get the same blood flow to those organs, and so the function of them, kidneys are mainly used for excretion in the urine, and livers more for metabolism of drugs, and everything just slows down. So you can't take the same doses, you may have to spread the doses out, or you would have more side effects because you have that drug accumulated in your system.
And here's something I didn't know. There are no clinical trials with older adults to see how these drugs work, right? So we really don't know.
That's really true. I mean, and also we have a paucity of literature from pediatrics too. So everything that's being studied is for usually like a normal, adult male or person who doesn't have anything. Yeah, excludes
groups,
the extremes.
Yeah. And so tell us some warning signs that this crowd needs to watch out for and when they need to go to a doctor.
Specifically to these drugs. So a lot of the way these drugs work is they slow the gastric emptying time, okay? So they slow down your stomach. The food sits in your stomach longer, which helps your body work on those better and, slower, so you don't have this big boost. And so a lot of people, also with the blood flow to your stomach slows down, so this may cause gastroparesis, or some people already have gastroparesis because they have diabetes, and it's a neuropathic.
What is that? What is gastroparesis?
Oh, gastroparesis is actually what these drugs do. They slow down your gastric emptying time. And so it's a side effect of, or a consequence of diabetes sometimes in people. It's a neuropathy in your stomach. And so if you already have that and you take these medications, it can cause some really bad side effects
and what are those side effects? So people watching.
Mostly with these drugs, it's almost definite that you're going to have stomach pain. Nausea is a big one because the food's sitting there longer, and then you won't be able to finish your meals, which is how you lose weight, because you don't eat as much, and plus you're nauseous and you don't feel like eating. I mean, it's not, I always say these drugs are not for sissies, right? So these are like really strong drugs, and we have to be very careful with the people that we.
So at what point, like is it day 2, day 3 of nausea and these symptoms, do they go to a doctor? When does it become dangerous?
Well, I always tell people that I'm counseling that, on the first day that you take it, it's once a week, they're once a week injections. The first day that you take it is going to probably be the worst into the second. So I warn people, why don't you take it in the evening so that when the worst nausea hits you, you're sleeping and you may go through it. And then after the second day, it starts to wane. When you should call a doctor is like if you have severe stomach pain or constipation or diarrhea or any kind of GI discomfort that is what you would consider severe, you should contact.
Dr. Jodie Pepin with Harbor Health with lots of good information. Thank you for your time, and thank you for joining us.